Hi everyone, welcome to your lecture on standard terminologies and nursing documentation. Prior to knowing the significance of nursing documentation and standard terminology, I too would dread a topic on nursing documentation as somewhat of a known burden of our job. But I want you to go into this topic with an open mind and understand that this is so much more about part of what we do and how we optimize how others see the value of our work and of our interventions, and how nursing care improves patient outcomes, and that this is evident in the data from our documentation. So let's get started. The value of nursing documentation has certainly evolved. In the 1970s, in which I was alive, nursing notes were actually destroyed after a patient left the hospital. When we have the absence of nursing data or outcomes potentially related to nursing, we lose basically our value. An example of this would be documented assessments and interventions performed by the nurse that prevented complications such as a UTI or a pressure ulcer. There was a time when it was assumed that if something bad happened to a patient, it had to be related to the nursing care. But in fact, we know that's not necessarily true. We know that when we document our nursing care and our interventions, many times, it usually results in not the documentation, but we usually see positive patient outcomes. But with that documentation, sometimes patients develop a complication no matter what we have done. But we've been able to document that we've done the evidence-based documentation. We certainly do not want our nursing data to be lost. And data that is being driven, we don't want that lost because that data drives our current healthcare system. Without data association or the absence of nursing terminology, we create a mystique of what nurses contribute to clients' health, wellness, and their outcomes. Therefore, nursing documentation and standard terminologies are essential in today's electronic health records and today's world. From a historical perspective, there are some significant people who were game changers related to revealing nursing data. As I said earlier, in the 70s, nursing notes were thrown away from the record after a certain time that a patient was discharged from the hospital. There was a woman named Edna Hoffman, and she was a manager of medical records department. And she wrote a book and said, we shouldn't be discarding these nurses' notes, as they really are the evidence of the communication and the interventions that were done by nurses during hospital stays. She wrote a book and things changed. Pretty impressive, right? And then if we look at Florence Nightingale, I call her the data queen because Florence is the one who captured data and pulled that data together for an analysis and said, hey, if we wash our hands and have better ventilation, our patients probably won't get infected and they'll have better outcomes. There's another woman by the name of Bertha Harmer. Bertha created the concept of prescribing nursing care, as in prescribing nursing interventions related to a diagnosis to achieve a certain outcome. This prescriptive relationship is our nursing process and the data and evidence that relates to the care of the outcomes. So, also in our history, as things move forward, was the development of nursing standard terminology by the American, it was established by the American Nurses Association in 1995 to have nursing information and data set evaluation center. At that center, the purpose of it was to make sure that we had standard nursing terminology and that was identified and would be used to develop electronic and digital documentation systems. Unfortunately, we came into the game a little late, so some of that terminology was not built in the original systems, but certainly in decent time we're starting to capture the nursing data. It is important to understand the value of that standard terminology. When we are think of it this way, when you're trying to access literature, it's the standard terminology that drives your search and allows you to easily access data or data concerning a specific area of interest. Standard terminology also makes it easy to access data concerning specific aspects of care, such as central line care, standard terms. Standard terminology, especially when used in various systems, attributes to ease of information between providers, hospitals, pharmacies, and so on. Finally, standard terminology also allows for empirical data and clinical decision making to be readily available. So, when we talk about standard terminologies, there are different types of standard terminologies and data sets. Although you won't be directly working with these, it's important to know as a baseline as it relates to the information that are in the data sets. So we're going to start with minimum data sets. Currently, there are 2 nursing minimum data sets, those that are related to clinical and those that are related to management. The nursing minimum data set for clinical use is pretty self-explanatory. The service elements are unique numbers for registered nurse providers, which are important to capture nursing-specific data related to nursing as a whole. There's a very informative website out of the University of Minnesota that is listed on this slide and as a reference, and I really encourage you to look at this website. They have done some awesome work with minimum data sets and will provide you more insight into this. There's also nursing management minimum data sets, which are related to things like care delivery, staffing, employee demographics, and payer sources. These nursing management minimum data sets are critical to the manager to capture information about unit functioning and outcomes and to help drive decision making for the unit. So beyond nursing minimum data sets and the such, there is also a thing called interface terminologies. These terminologies include clinical care classifications, nursing outcome classification, and both national and international nursing diagnosis terminologies. When we think about interfaces, it's important to understand that these terminologies need to be standard to allow them to connect to multiple systems. Another term we use is the term of reference terminologies. Reference terminologies have to do with the actual codes within certain nomenclatures. You're thinking this is pretty technical, I know you are, but let's just think of this. The certain codes, there are a couple different kinds. There's what we call logical, observational identifier names and codes, and those are related to clinical data, something like vital signs or assessment data or lab tests and the like. And then there is systemized nomenclature of medical clinical terms, also known as SNOMED. And so when you hear that term, that's what they're talking about. These are reference terminologies that are used across health professions. So not just nursing, but also PT, OT, pharmacy, the like. Incorporation of these reference terminologies is required in order to have a EHR be certified and compliant with the meaningful use incentive payments. Obviously, we talked about the need for standardization of terminologies. Now we're going to talk about some factors about standard terminologies. And these include granularity, mapping, and nomenclature. When we're referring to the granularity, it's referring to the specificity of the data. For example, specific clinical data and assessments. Mapping, on the other hand, relates to bridging or matching of concepts from one terminology to another terminology. So, for example, oxygen saturation, lung sounds, and the nursing diagnosis of ineffective airway clearance. Nomenclature then refers to groupings of terms or names of words. The biggest takeaway I want you guys to get from this is that these standards need to remain standard. And if they don't, we risk not being able to capture the data on the output. So when nurses and other healthcare workers are asking for unique data sets or unique fields within their EHRs, they often run the risk of not being able to have that interface in the data, and the standards will be missed, and therefore you will lose the data on the output. You might want to think about how your organization may have made requests for unique documentation, and how sometimes after that you end up documenting in 5 different places, but you don't get the same data output of what you actually did. So, what are some of the issues going around standard terminologies? One of the biggest one in implementation is the lack of people being standard and keeping standard terminology across systems. Again, another issue which we just brought up occurs when clinicians want to create unique documentation, and again, they create the possibility of deviating from standards and potentially losing the ability to capture vital information. Standardization has come a long way in the last 20 years, and it will hopefully continue to improve with advances in our systems and educating end users to the significance of having those standards. Thanks so much for listening. Please let me know if you have any questions, and have a great day.